So this device is called the stabilizer. You can see here it's like a blood pressure cuff. That's the air bladder there. And if I squeeze it and put pressure on it, you can see that needle moves up. And you can use this as a biofeedback mechanism for your patient. So they'll look at the device as they're pushing on it. They can see exactly where that needle is going. And we're going to use this for the cervical cranial flexion test. Okay, so I've got the stabilizer here. I'm supine again. And I'm going to take this, I put it right in that cervical lordosis. So it's pumped up a little bit, and now I've got it just about to 20. I'm going to give it a little more air, just so that needle is at 20 when I'm at rest. So now, like we described in the lecture, I'm going to have the patient tuck the chin just until that goes to 22. I can do a 10-second hold here and relax. Now I'm going to go to 24. I go a little bit farther. I do 10 seconds and I relax. So for testing purposes, I want to see, can they get all the way up to the 30 mark? And I'm having a little bit of a hard time. But I want to see if they can hold it for 10 seconds. I'm doing the same palpation that we did before. So I want to make sure that they're not using their sternocleidomastoid or scalenes while they're doing this. So you can use the test as sort of a baseline, those 2 millimeter of mercury increments, and using your 10-second holds. Or sometimes I'll get to the point where if the patient can hold to 30, I do my palpation, I'm pretty good. Can they hold it there for 30 seconds? It's a little bit of a more precise way to make sure that they're utilizing the right muscles, measuring just exactly how much pressure they're putting, and a good sort of beginner way to build up the strength of the deep cervical flexors.